Our priceless NHS, often hailed as the proudest achievement of modern society, and so it should be. After all, it provides free healthcare for everybody without discriminating against age, race, sexuality, disability, or even social status. But a much closer look inside at the professionals that really hold our precious health service together, and unfortunately, it's a slightly different story. A few months ago, I unintentionally came across this very well-written report about allied health professionals, better known as AHPs, and the quality of care they deliver. Being an AHP myself, of course I was curious, so I read it. The report for Quality Watch said things like the majority of AHPs work within the NHS, accounting for 6% of the NHS's workforce, and over £2 billion in salary. Now, this report highlighted a very important point, which is that despite the size and significance of the AHP workforce, AHPs are rarely the subject of major policy debates, and there's a concern that their contribution to care is often hidden, overlooked, and potentially undervalued. So how is it then that the bosses up top tend to innocently miss us off the radar when new commissions are being put into place? My colleague Joanne Fillingham from We AHPs has a few things to say about this.
Whether they've been overlooked or potentially undervalued is a good question. Back in 2013, Dr. Oliver stated that it's impossible to deliver effective care without the crucial contribution of highly trained allied health professionals. However, also in his blog, he did criticise AHPs for not being self-advocates and suggested AHPs could be more visible in promoting their roles and skills. More recently, Jill Hitchcock wrote an article for The Guardian, How an Overlooked Workforce is Key to Rescuing the NHS, and stated that AHPs are well primed to address key challenges facing health and social care, so why do they continue to be under-recognised? One thought is that the contribution of the 12 professions provide to populations is so wide and varied that they don't just fit into a neat box like doctor or nurse, and are therefore often difficult to describe or understand. Reports like the one Joy mentioned earlier are important because it highlights the need for succinct evidence or data to support this understanding of the unique contribution of AHPs. I believe change is already happening. As a consequence, there is much more of an opportunity for AHPs to speak up and demonstrate how they are key to rescuing the NHS. The production of these films describing AHP intervention through the eyes of the patient is another step to raising this awareness of allied health professionals.
It's about time we put AHPs on the medical and social map, and that is exactly what a group of very passionate AHPs, myself included, have decided to do by making a documentary series. Believe it or not, we were all brought together through the power of Twitter via social media. Sheffield Hallam University, home to an array of AHP courses in the stately £14 million facility, have kindly agreed to sponsor our documentary series. Each episode in the series will show a real patient telling their story right from illness to recovery. And at various points, you'll also get to see the faces of us almost hidden professionals who've helped them along the way. You'll get to know exactly how we've helped and what impact our professional input has had on the patient's quality of recovery. We acknowledge that raising the profile of AHPs and our vital contribution to the workforce isn't just beneficial to only commissioners. We're extremely proud of what we do, and we want to inspire people wishing to attend university or training courses. We want them to think, I'd love to be a paramedic, or a music therapist, or even a podiatrist, not just, I want to be a doctor. We'd also love for patients and service users to feel confident that we're capable of making the right decisions for their well-being. In summary, AHPs are all about providing effective and efficient care using an integrated interdisciplinary approach with the patients and the carers at the very centre. This, of course, requires many more services to be delivered in the community, keeping people well in their own homes, ensuring that they can remain as functionally independent as possible. My colleagues and I would like to make the point that this level of service is virtually impossible to deliver without the crucial contribution of AHPs. And by making these mini documentaries, that is exactly what we're aiming to demonstrate. So watch this space.